This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting-edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. For those of you who enjoy listening to the Rational Wellness Podcast, I would really appreciate it if you could go to Apple Podcasts and give us a ratings and review. That will move us up on the list of alternative health podcasts, and more people will be able to find the Rational Wellness Podcast. Also, if you'd like to see a video version, please go to my YouTube page. And if you go to my website, drweitz.com, you can see detailed show notes and a complete transcript. Our topic for today is obstructive sleep apnea and how to treat it, both with a functional medicine approach along with traditional care. Sleep apnea is when a person has pauses in their breathing while sleeping, and each pause can last from a few seconds to a few minutes. And such pauses can happen many times per hour, per night. It occurs in 1 to 6% of adults and 2% of children, though I wonder if this number is actually higher in adults who've never been diagnosed. Sleep apnea may be obstructive, in which the airflow is blocked, or central, in which breathing simply stops, or a combination of the two. Obstructive sleep apnea is overwhelmingly the most common form, with central sleep apnea accounting for less than 1% of cases. So we're going to focus on the obstructive sleep apnea today. Patients with obstructive sleep apnea may not be aware that they have it. Common symptoms of sleep apnea include tiredness during the day, snoring, lack of energy, depression, ADHD, and behavioral problems in children. Sleep apnea increases your risk of heart disease, stroke, diabetes, heart failure, arrhythmia, high blood pressure, non-alcoholic fatty liver disease, obesity, car accidents, cognitive impairment, and neurodegenerative diseases like Alzheimer's. Our guest for today is Dr. Gould, who's a dentist with an interest in functional medicine. Dr. Gould has a background in public health dentistry, and his practice is called Modern Health Dentistry. And he has offices in both Manhattan Beach and in Woodland Hills. Dr. Gould is back for his second appearance on the Rational Wellness Podcast, first appearing on episode 17 over 2 years ago. Dr. Gould, thank you so much for joining us today.
Oh, great to be here. Thank you for having me again.
So, as a dentist, how did you come to be interested in treating patients for sleep apnea?
Well, there's definitely some background, that I'd like to discuss with you, is that we've all heard about this syndrome, obstructive sleep apnea. And I know that your viewers are sort of a little ahead of the average person. I want to help everyone out by upgrading the terminology. Is that we've sort of changed. We've gone away from OSA, obstructive sleep apnea, to SDB, sleep disordered breathing. And the reason is that apnea was something that we looked at 20 years ago, where older obese people would choke in their sleep, and then that's where you see them having the CPAP mask. But over time, what we began to understand is that many people had a lesser version of this syndrome called UARS, upper air resistance syndrome. And this was basically, we're starting to see this on younger, healthier people. And the obstructive sleep apnea name, first of all, it's an accusation of poor health. Every time that I would question my patients, I'd say, have you heard of sleep apnea? They would say, oh, no, not me. I don't have that. I'm a good person. I eat healthy. I eat low fat. I exercise. I would never have that. Or I sleep great. And it's really sad because so many people, their sleep has literally failed and they don't really have any good options. So this SDB is a much more broad label, and it can really bring into the tent everyone who has a sleep issue, because it's a range. And we have people at one end of the spectrum who have very severe apnea. And then we have people who are the other end of the spectrum who are just for the first time having issues with their sleep. And this is happening a lot with children. So this is something that we needed some more labels for, because we can't, apnea is literally Greek for without breath. And this came from the past, where we had this disease was initially discovered with basically Fat Joe, not the rapper. This was a character in Dickens' writings, hundreds of years ago, where this character was falling asleep and he was fat and he was eating all the time. And this is our archetype for sleep apnea, and it was called obesity hypoventilation syndrome. So basically, they looked at fat people and said, well, you choke and you snore, so that fat and that fat neck is causing this disease. And it's exactly the same as what we did with cholesterol and fat and obesity. Is we said, well, this greasy fat stuff must be making everyone fat. And it's just basically non-scientific extrapolation. So understanding that apnea is a term that we used to use, and it still fits, but this is a much more modern disease because this is happening to so many different people. Now, I got into this because dentists can help in the treatment of apnea by fabricating something called a mandibular advancement device, and that's a mouthpiece that will eliminate snoring and can greatly reduce the symptoms of apnea. It's a great allopathic medical treatment for this disease, is holding the airway open.
Okay. So what are some of the most common symptoms that you might see in a patient coming in your office that would alert you to the fact that they might have this disordered, would you call it disordered?
SDB, sleep disordered breathing, yeah.
Sleep disordered breathing,
right. Well, I think it's
a new acronym, SDB. We didn't have
to update it, but it's a much better term, because I think that what these guys, I got into this 5 years ago because dentistry was saying, hey, listen, your patients have this, and you can see these signs much more easily than other doctors, because we're seeing patients lying flat. We're seeing them with a bright light shining onto the airway, and I can see the tonsils. I can see what the tongue looks like. So the classic symptoms, the ones that people will notice, are daytime tiredness. The ones that we see from the dental chair are bruxism, clenching and grinding, and something called scallop tongue. That's when the tongue thrusts against the lower teeth all night long, and the tongue gets indentations. And those indentations are a sign that the part of the brain that controls the airway isn't functioning right. So a scallop tongue, bruxism, but we'll see insomnia. Generally speaking, we'll have patients may complain of heartburn or gastric acid reflux, often headaches. And then there's the snoring. Snoring is the most common complaint, because people will not sleep well, but they won't really know what the issue is. But if their bed partner is making a loud noise, that's an immediate issue. So the snoring is often one of the first signs that we see. But most people who don't sleep well anymore, they know they don't sleep right, but I don't know if it's an embarrassment, but we don't have this great set of tools. If you have an issue with your sleep, what do? And I know you and I talked about this. I asked you if you'd ever had a sleep study, and you kind of, you gave me the answer that I knew I was going to hear. And that is that, well, I kind of don't even want to know if I have this. I probably have it, but I don't want to be wearing the CPAP. And so what I want to do is I want to change people's perspective and let you know that you want to know if you have this. A diagnostic test, either a pulse oximetry or a home sleep study, this is something that you want to know about. And it kind of blows my mind that so many functional medicine doctors, they know sleep's important and they want to do some stuff. And so much of the stuff that you guys do will help with sleep. But the cool part about a sleep study is it gives you objective data. So my whole point, and what I want to share with your viewers, who are a lot of functional medicine doctors, is that this is not something that you push aside and say, oh, well, go see your regular doctor, go see a sleep doctor. There are no solutions. There isn't anyone that's being referred out to this wonderful doctor who looks at the whole person and says, let's talk about your insomnia and let's work through the different stages to get your sleep back. That doesn't exist. What happens is, and this, is that these patients will be sent to a sleep doctor. They'll wait 3 months. They'll go to a sleep facility, get all wired up for the polysomnography, which is the most intensive sleep study. They'll come home with a diagnosis of apnea and a CPAP, and they'll put it in their closet, and they're like, I'm good. And this is what's happening around the country, and people aren't really recognizing the dangers of apnea. And, you mentioned to me today that you were reading about this, and this disease is linked to everything. Of course it is, because you spend 1/3 of your life sleeping. And if your body isn't doing it right, you can't control that. You're going to bed and you're hoping that you have, the blinds are pulled, the room's the right temperature, you got a good pillow, and you got that great mattress. But now your brain has to go into a complex set of chemical reactions that is supposed to get you into sleep, 4 to 5 cycles of deep sleep and REM sleep and all this stuff. But there you're just putting your head down and hoping that it's going to work. So we're at this point where we don't have the tools. Doctors don't have the tools to fix this. And that's what I want to do, is I want to raise awareness of what this disease really is. This is not something that you get as a punishment. This is not something you get when you don't take care of yourself. I was diagnosed at age 48 by accident by doing a home sleep study for myself. And I eat well. I exercise 5 days a week. I take care of myself. Why would I have this disease? I'm a good person. And so this is really, it's really quite different. So, for you, when you have a patient who has a sleep issue, do you see that on the intake forms? That's something you question them about? And then what do you do?
Absolutely.
All right.
Well, we use various sleep hygiene recommendations. I ask them about, do they have a pre-sleep routine? What do they do in the evening? Are they looking at blue light? Are they looking at their computer screens? Are they watching TV? What are they talking about or reading emails related to work or finances
Right.
So, we go through a bunch of factors that would play a role in affecting their sleep. And, we're looking at cortisol, and we might do a salivary adrenal cortisol test throughout the day. Some patients have this spike in their evening cortisol. So that's something we can address. And, and then I'll give them a series of recommendations, blue light blocking glasses if they are doing some computer work, not looking at emails or talking about work or finances or, a whole series of things. And then, we'll consider what they're eating. Are they eating in the evening? And then there's nutritional supplements, melatonin, 5-HTP, glycine, magnesium, et cetera, that may be of benefit as well. So that's how I approach it.
Okay. Well, it's great. I mean, you have to understand that sleep apnea as a syndrome is a lifestyle disease, and it's multifactorial, like almost everything. And so, I want to go through and just define some things for your listeners so they can understand what apnea really is, and that the way this disease came up in the ranks is that this was a diagnosis for older men through Medicare who have to stop breathing for 10 seconds or more. So how this all works and why all those things you mentioned are a part of this is that the sleep apnea syndrome itself is basically a series of arousals. And basically what I mean by that is what's supposed to happen is that as we go down deeper into sleep and our body becomes more relaxed, we're supposed to be able to be paralyzed to go into those deep stages of repair, but still be able to breathe and swallow. Okay, so our brains have this incredible system to coordinate this whole sleep and breathing thing. And it all works great until we mess it up with all the things that we do in our modern life. And absolutely, blue light is one of them. The most simplest way to explain this is that melatonin starts to form in your brain after darkness, about 2-3 hours of darkness. Now, if you keep on putting blue light in your eyes, you're basically destroying your melatonin. So that's doing two very bad things. Number one, you're destroying the hormone that's supposed to make you tired and put you into sleep mode. But melatonin is a powerful antioxidant. And by decreasing and destroying melatonin, literally by the blue light going into your eyes, you're decreasing your body's ability to fight free radical damage, which will increase your chances for cancer. So blue light, too much blue light in your eyes, especially after the day's over, will increase inflammation and cancer. So it's a pretty profound correlation. This isn't something that we think about. We know this happens. So you definitely want to manage that. But the question is, now you have all the conditions right, and now you're gearing down for sleep. But what happens is that people's airways are becoming too relaxed. And the actual sleep program itself, the brain cells themselves, are not functioning at optimal level. And there's a couple of different reasons why. So once that airway becomes a little too relaxed, in very healthy people, it'll send a signal that the person's actually choking and will arouse them. In people who are more sick, the airway itself will actually completely collapse. The tongue will fall back and block the airway, and the oxygen level will drop until the chemoreceptors of the carotid artery in your brain tell you, hey, wake up, there's not enough oxygen. And that's when you get the spike or release of cortisol. This is a fight or flight reaction. This is the sympathetic nervous system going into high gear saying, hey, this is a threat. And this is exactly if someone's putting a pillow over your face and trying to choke you, except that it's your own tongue that's clogging your airway. And this spike in cortisol is called an arousal. And it makes you come up out of that deeper sleep. And then you go back and relax and fall asleep again. And this goes in cycles. And this happens certain times per hour. And that's how we grade the apnea, that it's normal to have some stoppage or slowing down of breathing and sleep. But we start to record them. And then we get to the severe, mild, moderate, severe. So there's a threshold of how many times per hour.
Let me just stop you for a second there on this cortisol. That's kind of interesting because I mentioned measuring salivary cortisol throughout the day, and we would take those readings 4 times during the day, the last reading in the evening. But with this scenario, the patient could have a low level of cortisol, but then because they awake in the middle of the night, that cortisol spikes, and we're not actually able to record that. And I can now see how this can play a role in the increased risk of diabetes, because it's well known that cortisol causes your blood sugar to spike. And a lot of times when I'm working with diabetics and we're trying to manage their blood sugar levels and they're getting a spike in the morning, I'm thinking, well, they must have an evening spike in cortisol. And it could be that they are, but it's not being measured by that salivary cortisol test.
That is correct. And again, so this is, I like to sort of shrink things down to make them simple. So this is basically an added stress on your body. So however it happens, basically you're being attacked all night long. And this is a stress to your body. That's why people get so sick when their sleep falls apart. And you can be assured that if there's somebody in your practice, if they're over 45 or 50 and they have diabetes, or if they've had cancer, they already have sleep apnea. That's a foregone conclusion, because these diseases are all related to the mitochondria and energy production. And this has to do with the autonomic nervous system itself. So those are patients, this illness is I like to consider this all one disease. This is the disease of modern living. Because if we were hunter-gatherers, sleeping on the ground, living as the sun came up and down, eating these whole natural foods, our sleep wouldn't get destroyed. There's multiple things that come together to destroy our sleep. And so this is literally the disease of modern living. But you have to understand that if the autonomic nervous system, the part of the brain that is regulating circulation, digestion, sleep, all of our housekeeping duties, all of the things that we don't need to think about, if that system and control system is broken, then whatever it controls is a malfunction. And so if the brainstem itself, and we're looking at 2 separate parts here, I'm looking at the part of the brain that controls the bulbar muscles, or the muscles of the airway. It's generally cranial nerve 7 through 12, but the 5th cranial nerve is in there, the muscles of mastication, the trigeminal, that's my nervus dentis. And so the brainstem itself, as a controller of all these different things, if the neurons of the brainstem themselves are not healthy, whatever message, whatever they're trying to control and regulate, it's short circuit. And that's what I see. So sleep apnea is only one expression of this syndrome, which is a disease of the autonomic nervous system. And the reason that we focus on sleep is that your digestion is affected, your circulation is definitely affected, but the sleep becomes obvious right away because you can hear snoring, it's loud, and you can feel tired, it's obvious. Your circulation and digestion may not be ideal, you may have a little bit higher blood pressure, but this is what's going wrong. It's the controlling neurons of the autonomic nervous system that are supposed to be directing this very specific cascade of neurotransmitter release, and all this stuff that's supposed to happen really elegantly starts to malfunction. And you can go right to one of the simplest things, and that is snoring. What is snoring? Okay, so let me ask you this, Ben, what causes snoring? What's the root cause of snoring? Because that's what we're here for. We can put a piece of plastic in the mouth and eliminate snoring. That's a great allopathic treatment. And we've basically hidden the signs of the disease. But why is the snoring happening in the first place? And isn't that the whole goal of functional medicine, is to address the root cause and let the body restore itself? And this is one of the biggest root causes, because every day we stress our bodies and we break it down, and we're supposed to go to sleep and regenerate and refurbish all the chemicals and really heal. And if we are not getting into those deep stages of sleep, we're going to break down prematurely. And that's what this syndrome is. It's literally premature aging. Our bodies are aging faster than our ancestors because we're not able to repair in sleep, because almost everyone's sleep is broken. I've seen thousands of sleep studies. So you look like you have a question or thought on that, because it's a lot, but that's what the syndrome is.
Yeah. What percentage of people do you think have at least a mild version of this?
Well, so I have a little package I like to bring to when I go to visit my functional medicine doctors, and I show them a sleep study of a 23-year-old petite female whose apnea-hypopnea index is high. It's 27. That's almost at CPAP. She's a petite female.
What does that mean?
So it means that there are people that you see on the street that look completely healthy that already have very bad apnea.
What does 27 mean? How does that?
So the correlation we have, basically anything under a 5, and the score is how many times you stop breathing for 10 seconds or more. So this is already well into real apnea. This isn't upper airway resistance syndrome where you have reduced breathing. This is somebody who's stopping breathing. She has the same level of apnea that I had when I was diagnosed, and I was 48. And she's 23 years old and petite, eats healthy, goes to the gym, and she has terrible apnea. Based on seeing this over and over again, these young people who come to me who can't sleep and they all have terrible apnea, I would say that probably it just depends on where you're at and how people are living, but almost everyone has this to some degree, and especially in kids.
Okay. So that's kind of what I was thinking.
Yeah. Almost everyone.
Almost everyone has this,
yes,
to some degree.
To some degree, yeah. And, there's all kinds of weird stuff that's happened that doctors aren't getting. When babies are delivered, they have apnea. They don't breathe. And what do? They put them under a UV light. Okay, and what's that UV light doing? Well, you and I know the UV light is doing multiple different things, but let's go back to the question, what is snoring? What do you believe snoring is caused by? Because I'm curious as to your thoughts. You're a well-traveled, educated person. What is the root cause of snoring? And can it be reversed instantly? Aside from putting a mouthpiece in. And there's no wrong answer here, so I'm putting you on the spot.
Yeah, I never really thought of it about it too much. My own experience with it is it seems to occur sometimes it doesn't.
Right.
So
some people snore when they have a drink.
I'm assuming the answer is because they're not getting enough oxygen, right?
No, and so that's not the case. Yeah, okay. Which is interesting because it's all related. But so you have to think about what is snoring itself. Snoring is a vibration of the soft palate. That's it. Okay, and so it doesn't really matter. Everyone has this specific thought. There's those commercials where they put the bed up and they stop snoring. And yes, there's a positional component to snoring. If you're lying on your back, that's when your palate's in the best position to flap when you breathe. Okay, and if you turn on your side, maybe you won't snore. But some people will report they only snore when they drink. Well, what does alcohol do? It's a central nervous system depressant. So the answer to my question is that snoring itself is a primary vitamin D deficiency, followed by a secondary B vitamin deficiency, specifically B5, which is the precursor to acetylcholine, which is one of the primary neurotransmitters of the autonomic nervous system.
And B5 is pantothenic acid.
Pantothenic acid, correct. Okay. So there's two parts to the reaction. One is that in the brainstem, you need to have a high enough vitamin D level to transcribe the enzyme choline acetyltransferase. And that's just an enzyme that makes acetylcholine. Okay. Now, you know that vitamin D is really important, and you know that it's important in absorbing calcium, but no one asks the questions of, well, how does vitamin D make you absorb calcium? Why is it related to all this other stuff? And it's because it allows you to upregulate transcription of your genes. So in a really simple way, when you add more vitamin D, you give your body the energy to allow for more copying of your own genes to allow you to make the enzymes to stay healthy. Okay. Now, doctors are looking at vitamin D the wrong way, and you already know this, that most people should have a level of 50 or 60. That's what we'd see if we lived out in the wild. And so when we raise this level up, now we're finally giving the body the fuel to be able to transcribe all the appropriate enzymes. And when your vitamin D level is low, I like to call it human power saving mode or permanent winter, because throughout all of evolutionary history, when your vitamin D level was low, it was winter. And your body's smart. It has an adaptation to winter. And when the D level comes down, your body no longer has enough energy to transcribe all the enzymes it wants to make, okay? So I'm going to assume that natural selection over thousands of generations has decided, as your D level drops, which enzymes am I not going to transcribe? Which ones are not so important, okay? It's like if you're making $200,000 a year and you're getting massages and all this fancy clothes, then you start having your salary cut over and over, you start to give up the esoteric things first. But after a certain point, when you're starting to, not have enough money to pay the rent, okay, that's what vitamin D deficiency is like. When the D level goes down low enough, you no longer have enough energy from the sun to transcribe the most basic and important enzymes, the ones like glutathione, or superoxide dismutase, the enzymes that will detoxify free radicals. And that's why vitamin D deficiency and health are so linked. And, doctors aren't really necessarily understanding that this one thing, just on its own, the vitamin D, is a massive issue, that humans are literally solar-powered animals. And we use that energy from the sun to power our reactions, okay? But that the vitamin D is also tied to the immune system. So as soon as that level goes down, our immune cells, our macrophages, all of our blood cells, they no longer have enough energy in the form of vitamin D to transcribe the genes to make the antimicrobial proteins to be able to kill bacteria, fungus, and virus. So now your immune system is shutting down because we don't have enough energy to run that, and that changes the gut bacteria. Vitamin D regulates the type of gut bacteria that you're going to have, and as that level goes down, the healthy gut bacteria that we like, the ones that promote all the B vitamin production, the ones that keep our muscles healthy and give us serotonin and dopamine, all the really good chemical products that bacteria make, they disappear. And that's where we're really in the depth of power saving mode, okay? And so as our D level comes back up in the spring, and we have those antimicrobial proteins that our bacteria that are colonized can now start to filter and decide what bacteria we want to keep, we're going to go back to those ones that make the B vitamins, because you know how important B vitamins are. They're interjected into every single reaction, especially the production of energy in the mitochondria, especially the repair of DNA. These B vitamins are used by Mother Nature as neurotransmitters, or as the basis for neurotransmitters, as cofactors in enzymes in the electron transport chain. These are Mother Nature's helpers, those B vitamins. And I think that, you deal with a lot of people who are very sick who need that one-on-one help, but so many of the general public would benefit from just keeping that higher vitamin D level, because it would naturally provide more B vitamins. And that's kind of the equation. So the second part is in the brain. Having enough of B5 to make acetylcholine is critical. And if your D level is low and your gut bacteria is not making B5, you're not going to have enough acetylcholine, and you're going to lie in bed, and your brain is going to be racing thoughts, and you're not going to be able to shut down for sleep because you don't have one of the primary neurotransmitters for the sympathetic nervous system to go into the rest and repair phase, rest and digest. And that's the equation, the vitamin D to make the enzymes and the B vitamins to be the raw material for the neurotransmitters. And you can think about how all these different reactions of B vitamins are so important to cellular production of energy, that if you don't have enough, everyone's going to break down differently. And so the snoring itself, we'll see this in children, they can stop snoring in 2 days, 3 days, 4 days with vitamin D supplementation. In adults, it can happen that quickly, but it depends how long they've been snoring for. Is the part of their brain damaged yet, or is it just suffering temporary breakdown?
Now, isn't the way you breathe also play a role in this? Whether, for example, whether you breathe primarily through your nose or through your mouth?
Yes. So humans were designed to breathe through their nose. When you breathe through your nose, it filters and warms the air. It basically provides nitric oxide, which causes a vasodilation. The lungs can expand fully and bring in more oxygen. We have a whole system, and that system breaks down when we can't breathe through our nose. And we can't breathe through our nose primarily because we have some inflammation. It could be allergies, colds, flus. It could also be a deviated septum. And these are all issues that happen primarily in our youth when we're growing and developing, and can affect our airway. So we definitely want to breathe through
Isn't it very common that a lot of people end up being mouth breathers?
Absolutely. It's one of those things where you've probably heard of mouth taping. People are taping their mouth,
Yes.
force themselves through. Yeah. And that can be curative for some people who are having sleep and breathing issues itself. There's also, you've heard of Buteyko breathing, and that's where you basically
I took a bunch of lessons in that to try to improve my nose breathing.
Right. So the only issue is when you fall asleep, how's that going for you? Can you control that? And so the answer is no. But if you tape your mouth, you're going to wake up pretty fast if you can't breathe through your nose. So I think it's kind of a cool technique. And I don't think anyone's really put the time and research in to figure out just how much that mouth breathing and nasal breathing affects us. Again, this is a multifactorial issue for some people that can't breathe through their nose. And, so it's very, very important. We see this in kids a lot. If you have, the pediatric patients, the kids who suck their thumbs, kids who wet the bed, kids who have ADHD, these kids are all severely sleep deprived. And the issue that they're having is now they're going through their growth and formation of their airway, and they're breathing through their mouth, which narrows the palate. And it really amplifies the issues that we see. So this is a really terrifying syndrome where as children, as they start to grow and develop, if they don't have the proper vitamins, and that's a vitamin D3 and vitamin K2 combination, the airway itself won't grow properly. With low D3, colds, flus, allergies, low K2 is you have early calcification of the nasal septum and not enough calcium going into the jaw for proper normal growth, and the airways being compromised. And that's what I'm seeing on all the kids these days, is these tiny airways, literally from a vitamin D3 and a vitamin K2 combination. And this is something that Weston Price discovered 80 years ago, and no one listened.
And this is literally looking at someone's face, that if their jaw's face structure is narrow, that's what we're talking about, right? Isn't it called like narrow face syndrome?
Yeah. Well, so long face syndrome is basically when the palate is narrow, and it's created through mouth breathing. So when you breathe all night long with your mouth open, it puts muscular pressure to narrow the palate. And the jaw itself, the lower jaw, takes its growth cues from the upper jaw. And the development of the jaw itself is not pre-programmed. When we start to grow as children, the size of our brain is pre-programmed. So our cranial size is going to be already laid out. But the jaw growth itself is reliant on the conditions that we're in. And we see this really profoundly. It's a concept called epigenetics, okay? And Weston Price, over 80 years ago, discovered that when two substances were removed from the food chain, he saw dental decay, gum disease, a collapsing of the arches, lack of room for all 32 teeth, and an illness in general. And those two substances that he defined back in those days turned out to be vitamin D3 and vitamin K2. And it makes perfect sense because vitamin D is your calcium absorption hormone, and vitamin K2 is basically a cofactor that activates proteins that bind calcium in your blood and take that calcium, put it into the matrix of bone and teeth. We'll find those proteins in the mouth trying to bind salivary calcium and put it into our teeth. This was a system, because we're made so much of calcium, that in the summer, and when the sun is high in the sky, we're getting a lot of vitamin D and the grass is green, and we're eating the meat and milk of animals that eat that green growing grass. That's when we're onboarding all this calcium, and we'll put it into our teeth and our bones. And in the winter, when there's no vitamin D and there's no green grass, our body's going to say, hey, I don't have enough calcium. I'm going to go into those bones and I'm going to pull that calcium out and utilize it. So the D3K2 was a system of managing our calcium to be able to allow us to be healthy throughout the year through winter. This was our winter. We basically have this whole other setting where we can, in the northern hemisphere, when we're away from the zone of guaranteed sunlight and green vegetation, that we can live off of our stores, we can eat animals. And so the system is really messed up because everyone, as you know, has descended into a vitamin D deficient state that I call permanent winter. And kids these days are all really suffering from the syndrome. And it was something, again, defined 80 years ago by Weston Price. I didn't learn about Price's work in dental school 30 years ago when I was in school. And today he's still not taught. And it's quite interesting as to why, we could tear him apart with all of our new science. But unfortunately for, the big institutions, his work is being clarified and defined by the new science. And this is all really obvious stuff. But I'm trying to get the message out there that this is the root cause of pediatric sleep apnea, something that can be reversed in 1, 2, 3, 4 days. And children are having surgeries and wearing CPAPs. I've got 8-year-olds who've been wearing these, this is destroying these kids' lives. And this is simple vitamin and mineral deficiency. This is a D3K2 combination. So
interesting, fascinating. Great information. Can you explain a little bit about the connection between this sleep apnea, breathing problem, and heart disease?
Sure. So there's two different ways that this affects you. The first one is the actual whole sleep apnea syndrome, where you're choking in your sleep. And again, the stress on your body, if you're a hunter-gatherer out in the wild and there's a lion or a tiger or something scares you and you have to run, that was probably relatively common. But this whole syndrome where your body's having that full-on reaction, fight or flight, is happening over and over. And this is a terrible stress on your body. And for people who aren't healthy to begin with, they don't know that they're basically running this marathon where they're being chased by an animal all night long and being suffocated. They just wake up feeling terrible. So the stress of the hypoxia, lack of oxygen, and the release of cortisol over and over again is very taxing on the body, number one. Number two is these are people who already are not healthy. They already have completely inflamed vasculature. And the stoppage of breathing and the increased heart rate that happens after the arousal is signaled, after you're woken up. Many of your listeners may have had this where you wake up and you're sweating and your heart is racing. That's apnea, guys. If you've woken up several times in the night like that, you have some form of apnea, and it's reversible to a certain point. I think it's reversible all the way. It just depends on how much work you want to put into it. The second part of the cardiovascular issue is that the root cause of sleep apnea is a primary vitamin D deficiency with a secondary B vitamin deficiency. And the cardiac cells, the endothelial cells themselves, are suffering from an inflammatory process because those cells themselves cannot make enough of the anti-inflammatory enzymes that you can Google any of your enzymes that eliminate free radicals, and you'll see that supplementing vitamin D will increase their production and decrease the overall stress and inflammation of the cell in the body. So it's complex because the endothelial cells are involved, the cardiac cells are involved, and then we go back to the brainstem. If the part of the brain that's regulating everything cardiac has issues transmitting the right message in the right way because it doesn't have the right neurotransmitter mix, the actual signal, the cardiac signal, and how your whole body's run by the autonomic nervous system isn't functioning right. So it's coming at us from all different directions. It's basically the overall poor health of a person because this is so multifactorial. But when someone has apnea and it's detectable like that, they've been sick for a long time and they have the other markers of inflammation as well.
So when you have a patient with sleep apnea or disordered breathing.
Sleep disordered breathing, right. Very good.
How do you decide what's the first step?
Okay. So I like objective data. Anyone who comes to me, I want to use two different types of monitoring devices. I like a pulse oximeter. We send the patient home with that, and it gives us an idea of the severity of their apnea. If the pulse oximeter shows them stopping breathing, I'm going to immediately recommend a home sleep study. Now, if this is someone who has serious health issues, they should go to a hospital facility and have a polysomnography done by a medical sleep doctor, because these are the people that have to be on CPAPs. And those are the people that probably aren't even coming to you. They're really sick and they're in that paradigm of allopathic medicine. But we can detect the apnea and do a sleep study that will show, 1 night, 2 night, what's going on, and will show whether this person is getting REM sleep, whether they're getting deep sleep, and are they choking? What's going on? Are they having hypoxia? Because we'll see the oxygen level drop 3 or 4%. You cannot hold your breath and do that. That's a stoppage of breathing. All right. So this gives us an idea of who has this. And in my opinion, anyone who has any health issues at all should have their sleep screened, especially if they complain. So some people will come in saying, I don't sleep right. Some people, they'll just be sick and they won't know. I did not know that I had apnea, and mine was pretty bad. It wasn't on my radar just because I was thinking about an older, heavy person who didn't take care of themselves. Not me. Like, why would I have it, right? So this is something that you can only tell literally. I have children, I have adults. I recently had a 52-year-old woman who was a bit overweight, but she had the best sleep I've ever seen. She'd been taking her vitamin D. She was relatively healthy. So you can't tell by looking at anyone. You have to really have an objective study.
So you do this objective sleep study. This person comes out positive. What's the next step? Do you test them for vitamin D? Do you measure vitamin B levels? Do you just try them on vitamins? What do you do first? Do you look at diet and other factors?
Right. So as you already know this, different people will have a varying degree of interest. So at the most simple level, I'm going to provide all my patients with an oral device if they have a diagnosis of apnea. If they're health-oriented...
Oral device is designed to move their upper jaw forwards to create more space. Is that it?
It does a couple of different things. So the mandibular advancement device, lots of studies showing that's effective. Primarily, it's going to hold the lower jaw forward and open, and it increases the size of the airway and makes it harder for the tongue to actually fall back all the way. That's one thing that it does. The other thing is that by holding the jaw further forward, in a lot of people, it will put pressure on the palate where the vagus nerve runs across. And sometimes that tongue on the palate will actually stimulate the vagus nerve and will decrease the apnea syndrome. I know that this is a very big topic, is vagus massage, all different things that will help stimulate that nerve. And I believe that there is a component, because I will see some patients who have a profound effect with the oral device, maybe more than they should have just by making extra space. And I literally see like a change in how their brain is sending out that sleep signal. And I don't think anyone really knows, to be honest with you. Most of my profession is still stuck on that this is a structural disease, that there's not enough room in the airway. And I want to dispel that myth right now, because if you can breathe while you're awake, then you can breathe while you're asleep. There's no obstruction. This is not a physical obstruction. This is a relaxation of the musculature. So everyone, I'm glad we got away from the obstructive sleep apnea, because there's no real obstruction. This is a problem with how your brain is regulating the musculature of the airway and the sleep program itself. So
I've had patients who had surgery to grind down some of the bones in the back of the throat and create a bigger space. And
sure. Well, it's sad because some people are going to need surgery, and there's nothing wrong with that. Surgeons are great. They're talented. But so this is my thought process. If someone's willing to go along the ride with me, I will do a vitamin test on the spot, or I'll get their most recent level. I have a protocol that I want to get someone into the right zone. And then the issue really is that when someone comes to me, I don't know how severe their apnea is. I don't know. It depends on how long they've had it. So keep in mind that the part of the brain that's regulating this, day after day of hypoxia, causes brain cell death. And you know that the cerebellum in particular is very susceptible to hypoxia because of the Purkinje fibers are really big, and they're the first ones to die. So once this is going on, this system where you're stopping breathing, you have hypoxia, and damage starts. This will go on for many years until the brain itself and the different parts of the brain are damaged enough that no amount of vitamin supplementation is going to fix this. You need to put in a physical barrier to keep that airway open, because the brain itself can't heal. It's not getting into good, deep restorative sleep. So if we can change the vitamin mixture to provide health, and we can splint the airway open only night after night of deep restorative
sleep. Okay, so you're measuring vitamin D. Are you measuring vitamin K? Are you measuring B vitamins?
No. So the K always comes along with vitamin D, because you could never get vitamin D without K2. They always came together.
And are you using the MK7 or the MK4, and how much?
So MK7, everyone's sticking to the 180 to 200 micrograms. No one's really investigated this any further, but this was all from the Rotterdam study. This is a very famous study that's happened over the years that most doctors who haven't heard about K2 should look at. But I don't know that we know the optimum level of K2. I just know that it's currently known to be a cofactor on 17 different enzymes. And K2 is really, if it's a cofactor on 17 enzymes and we got it from green growing grass, it's really important. So there's no upper limit on toxic dose, and I think that the more you can get, the better. But I make everyone take it 180 to 200 because I want to stay within the bounds of what's accepted science at this stage. So I supplement magnesium. I get the vitamin D levels in the 60 to 80 range, K2 daily, and then I go to a B vitamin, and I want to use my B vitamin very judiciously depending on the person. And this is a very personal
B vitamins.
I don't. This is the issue, is that if you measure a B vitamin, what are you measuring? It's a water-soluble vitamin. Are you measuring the current state? Where are you getting your sample from? what does it look like 1 hour, 2 hours, 12 hours? How long do B vitamins last in our system?
Well, I mean, there's various things you can measure. Say B12. You can look at a serum B12, but you're right, probably not that representative of tissue levels. But then you can measure a homocysteine, you can measure a methylmalonic acid. So those are more functional measures of B12 status.
Right. So B12 is the only one that I can recommend supplementing on its own. Otherwise, I'm always want a B complex. These are things.
And then we also have genetic factors that affect whether or not you can metabolize B12 or folic acid, et cetera.
Right. And that's what makes this such a confusing syndrome, is that there's all this genetics and epigenetics mixed in here. And medicine has really focused on the genetic component of all these diseases. And, this is like kind of one of the things I joke about is if you go to your traditional doctor and you're obese and you have high blood pressure, they say, well, listen, you have high blood pressure, cut your fats, do some exercise, lose some weight, and then we can maybe get you off the medication. But if you're fit looking anyway, and you go to the doctor and you have high blood pressure, they tell you it's genetic, and then they give you medication because you're going to have to take this the rest of your life because you have this genetic issue. And it's all nonsense. Your genes are there, but it's all the environment. So, even the people who have these genetic issues, a lot of them have the issue with B vitamins. They need more B vitamins. Okay. But the B vitamins are fascinating because they are a parallel to the bees, the insects in our environment. They're literally under attack by modern living. The bees are affected by glyphosate, pesticides, heavy metal toxicity, radiation, all the same things that are destroying our B vitamins as well. They kind of cool.
So how much B vitamins do you often recommend?
So it's going to be on a case-by-case basis, and this is people need to decide. And what I see, it depends on how long someone's been sick for and how sick they've been. Most of the modern diseases, these autoimmune diseases, they're a D followed by a B deficiency. And I have patients who are healthy their whole lives. And I have one of my favorite patients is a fitness trainer. This guy was fit his whole life. And then he started to put on weight, didn't know it was wrong, basically got completely unhealthy within 6 months to a year. And when I came across him, he had completely uncontrolled, untreated sleep apnea. And so this guy had a rapid recovery, and he didn't need a lot of B vitamins, where someone like myself, who I've been sick my whole life, I need more B vitamins because apparently most of my illness was related to this, having that chronic lower level of vitamin D, being stuck in permanent winter, not having the right amount of B vitamins. This really did a lot of damage in my life and my illness. So I tend to take more B vitamins, but the B vitamins are used up by being in the sun, drinking alcohol, and exercise and activity. So once this happens, once someone's already become unhealthy, I really work with them on deciding how to take their B vitamins. They want to take it in the morning. They want to take it before bed. Too much can cause people to have insomnia as well. But for the most part, having a little more B vitamins later in the day can help you with your sleep. Simple as that.
And I'm assuming you're using methylated or activated forms rather than straight folic acid and
correct.
B12 or hydroxy B12 versus the cyanocobalamin.
Right. So I spent a lot of time researching B vitamins, and I always try my vitamins, my vitamin line, they're methylated. There's such a variety in the vitamins that we buy. There's no one regulating this. And that's why I always say, go to a reputable company that checks their own stuff. You're buying stuff off the internet, and I don't know what you're getting. And some of it's filler, some of it's real. But the real issue is that no one's really spending the type of money, time, and energy looking into these things. Because this is really what our health comes down to is, and who has the money to do this? That all the research is driven by big pharma, and they're not interested in these vitamins. This is an organic way to get healthy, and they're not looking at that. They have not sworn an oath to do no harm. They've sworn an oath to their shareholders to make money, and they're going to make this, any way they can. Have you seen some of the commercials? They have these new ones where they're showing this woman, and she's in a hospital bed with dark circles on her eyes, and she's missing her son's wedding or something. They're really playing on our fears of poor health. It's really terrifying. So no one's going to be looking into this, and there's so much research that needs to happen on what these vitamins are doing. And we're coming to this in different ways. People who are eating a ketogenic diet, we're coming to all the right solutions. It's just that this is the Wild West, and you have your own system for how you treat people. How often do you test B vitamins? Do you ever, to supplement more than just, except for B12, do you ever give a single B?
Sure. Or we'll use specific formulas. Like, for example, if I have a patient who has an elevated homocysteine level, which we know is an independent cardiovascular risk factor, an inflammatory marker, we'll use a certain combination of B vitamins and certain other nutrients that are specifically targeted to modulate the homocysteine.
Right. Do you worry about because those B vitamins are so reliant on each other, do you worry about upsetting upstream or downstream results when you supplement one B vitamin like that?
Yeah, for sure. And usually we're using mixtures, but I may use different combinations of mixtures. So like, for homocysteine, we're specifically looking at like a B3, B6, B12, B9 combo with certain other nutrients like trimethylglycine and maybe a few other things specifically to try to modulate that one factor. And then we're measuring it on a regular basis. So, we've got targets, we intervene, and then we retest to see if we're accomplishing what we're trying to do.
Great. That's cool. And again, it's really complex stuff. Now, I'm looking at this from, as a dentist, I'm looking at a macro world here. And the message I want to share with you and your listeners is that sleep is something that's well within your wheelhouse that you should be monitoring. This is something that you can use as a marker for the improvement of your patient's health, because I have no doubt that almost every single thing that you're doing is improving their sleep. It's genuine. Your patients probably tell you, wow, I'm sleeping better when you're doing all this other stuff. But I think that functional medicine doctors have this incredible opportunity to bring this into their practice. And what I recommend is to find a local dentist. You're going to have a hard time finding a local medical doctor to work with. But there are dentists in the community that want to work with you, that treat sleep apnea, that don't feel comfortable with this vitamin D stuff. And this is, I'm recommending a partnership, a collaboration, because dentists have this unique ability to put things into the airway to help with sleep. And we also, we are doctors, we have a different perspective, but I think that those relationships where you have a patient, you suspect apnea, but what are you going to do with this person? If you send them back out into that cruel allopathic world, they will wait 3 months to go see that medical sleep doctor, and they're all good people, but their solution is a CPAP for everyone. And I have had patients who have very mild apnea, an AHI score of 7 or 12 or something that's low, that they have this massive CPAP thing and they're not going to wear it. So there's a really cool opportunity with these people that are coming to you. They care about their health, is to give them that tool and be able to allow them to have a mouthpiece that can save their marriage with snoring, but it can definitely make everything that you're doing work better. When you start to see your patients having stable sleep and not having these arousals, you're going to see all of their markers change. Their inflammatory markers are going to change. You're going to even see their vitamin D levels change. There's a study where they put a CPAP on people and their vitamin D level came up. And it makes sense to me, because if you're running from a lion or a tiger all night long, vitamin D is a metabolic hormone, and you're going to wear it out. You're doing all these things. And there was no time in evolutionary history where you could get more exercise running around and not be out in the sun. That never happened. So everything that you're working on is affected by this. And, when it comes to your younger patients, you just don't know why these people are so messed up. This is why. A 23-year-old petite female, and nothing you could test. The only thing that came up on her studies was that she had a vitamin D level of 12. And that's why she had terrible apnea, because who knows how long she had that level for, and then choking in her sleep, it was just lowering it. So there's patients that you're seeing that are suffering from this syndrome that you can greatly help by going to a dentist and having some sort of sleep screening. That's what I've done in my neighborhood here. I have pulse oximeters. My local doctors will send a patient over. We'll do a quick exam and they'll log out a pulse oximeter, take it home for 3 nights, and we'll see if they're really a candidate, whether they should have a sleep study or not. So these are things that should be going on in your community with your local healthcare providers. I think the dentists are more open to this type of stuff than the average doctor.
No, that sounds great. Great. By the way, if you know of any studies that you have ready access to that you can send me about the connections between vitamin D and vitamin K2 and B vitamins, I'll throw them in the show notes.
Sure.
I'd appreciate that.
You got it. All right.
Good. So I think that about wraps it for today, being that it's almost 9 o'clock and I have a 9 o'clock patient. So
All right.
how can listeners and practitioners get a hold of you? Patients can either see you as a patient, or practitioners who want to work with you on sending patients to you for sleep studies.
Right. So you can reach us at modernamericandentistry.com. We have a location in Woodland Hills. We have a location here in Manhattan Beach. And if you have patients that you're questioning whether they have sleep issues, basically you can email me, you can call, you can just refer people over. And we really, what we provide is copies of the pulse oximetry to give you an idea what your patient's doing in their sleep, a copy of the sleep study, and then we get a prescription from a medical sleep doctor to fabricate an oral device. And we can work with you on the supplementation. So what I'm trying to do is create a protocol and system for dentists to be able to work locally in the neighborhood. That's what my main focus is. It's not so much treating the one-on-one patients. I've been doing that for a while, but I want to share this information from a preventive perspective for children and for people who are literally struggling today with their sleep, that there are some real tools here, and that most poor sleep is literally early apnea.
Great. Awesome. Thank you, Dr. Gould.
All right. My pleasure. Thank you.